Canada, among other countries, is racing to develop a vaccine for COVID-19. A process that normally takes years to complete is being condensed into months, with even the top infectious disease expert in the U.S. expecting results by the end of the year.
And I believe it will be when and not if we get favorable candidates with good results. We will be able to make them available to the American public, as I said to this committee months ago, within a year from when we started.
That was Dr. Fauci speaking in Washington. The timeline he mentioned is raising concerns about possible adverse effects that could come from the vaccine's use and how the victims could be compensated. For more, we're joined by senior scientist at the Ottawa Hospital Research Institute, Dr. Kumanan Wilson. Welcome to Your Morning.
Good morning.
Well, right now, Quebec is the only Canadian province with a vaccine injury program. If adverse effects or complications arise because of the vaccine, why couldn't the manufacturer be held responsible?
So in Canada, which we're the only G7 country that doesn't have a national program for vaccine injury compensation, the only recourse would be to sue the vaccine manufacturer. And to my awareness, there have been very few, if any, successful lawsuits against vaccine manufacturers. And that's because vaccines are safe. They undergo rigorous testing before they're released. And if an injury occurs, it's because of no fault of the vaccine manufacturer, but because of just rare events that sometimes happen. And in most cases, rare events are not a major concern, but when you administer something to the entire population, even rare events in less than a 1 in 10,000 event rate could have significant consequences.
Well, right now, with no vaccine injury program in place, except for Quebec, if someone does encounter complications, what kind of options do they have?
So they would have to try to sue a vaccine manufacturer. In the case of the H1N1 vaccine, when it was released during the pandemic, the government assumed the liability for the vaccine manufacturers in the condition for the vaccine being released. In the case of a COVID vaccine, I expect that to be the case as well, but that would still require individuals to go through the tort process, which isn't really fair for individuals who have been harmed. It's a lengthy process, it's arbitrary, and it's very expensive. There are far more efficient ways to do this, which many countries have implemented.
What is your response to people who are maybe concerned about the short timeline when talking about a COVID-19 vaccine between research, development, and then having it in the marketplace?
Well, we are desperately in need of a vaccine, and it can't come soon enough, as many of us are aware. It will undergo rigorous testing. It'll have to meet our regulatory standards. But the potential for unexpected events does exist. Even in high-quality randomized trials for vaccines, we can only pick up adverse events in the rate of 1 in 10,000. We saw with the H1N1 vaccine, there were very rare cases of something called narcolepsy that occurred in Europe. In 1976, there was an expected swine flu pandemic, and they released a swine flu vaccine, which caused a high rate of Guillain-Barré syndrome, a rare paralytic disorder. So these things do happen. They don't happen because of negligence. They're just unexpected, unusual events. But people are harmed in the process, and there really isn't a fair system for them in Canada, except for Quebec. And what I'm concerned about with the COVID vaccine is that the first individuals to receive this vaccine are likely going to be our frontline workers. Mm-hmm. And they'll be receiving this vaccine not only for their benefit, but to protect the vulnerable who they care for. And as an expectation of their job, they will accept this responsibility. And if they are harmed, it really isn't fair for them to have to go through a legal process, a tort process, where it's very unlikely that they'll receive compensation.
Are you recommending then that our provincial governments put in place, or our federal government even puts in place, an injury program here?
I really strongly believe now is the time to bring in a federal compensation program. I think it would be consistent with everything we've been hearing, that we're all in this together. We'll take care of each other. And we need to make sure that those who, as part of their duty, are receiving this vaccine, and if they are harmed, they receive compensation.
Dr. Kumanan Wilson, thank you for joining us this morning.
Thank you for having me.
As a final note on this story, we have reached out to the Public Health Agency of Canada asking if any plans were underway to create a vaccine injury program. We did not receive a reply. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.